All right, so we have a patient, 62-year-old male that's suffering from a massive heart attack, let's say, unconscious and intubated in the field. He's 6'2" and weighs 260 pounds. So I'm going to put him in volume control, which I already have here. These are my initial settings. According to his ideal body weight, we're going to start at a 600 tidal volume, eye time of 1, respirations of 14. When they did his blood pressure was normal, so we can do a PEEP of 5, slope of 0.2, an FiO2 of 100%. We'll want to wean that. Up here, I can hit alarms and check out all my current alarms, make sure that they correlate with the settings that I currently have. So that is all set up to our patient already. So when we come in and do a vent check, we are going to log onto our computer and pull up our flow sheet. So this is what our flow sheets look like. Over here on the side are the settings. So we want to verify the settings and the settings on here to make sure that nothing has changed, or if it has changed that we just update it. Here we can document the current values. So before we start any treatments or suctioning, we want to take the current values, because while we're doing some of those treatments, they can alter them. So here we have the tidal volume, minute ventilation, PIP, compliance. All those numbers can be found here. So we just take these numbers and plug it into our flow sheet. We're also able to verify our alarms. Down here in miscellaneous, do we have a humidifier in place? Yes, we do. Temperature, if we have the humidifier on, the temperature will read right there for us. And suction. So this time we are going to suction the patient. As you can see, there's this is usually kind of how it goes. So suctioning the patient. We are going to take our suction. It's usually in line already. We can hook this up to the suction canister up on the wall, set it to the appropriate settings, 120, 150. And then we are ready to do the suctioning. So the goal here is to not have this all bunched up, because when this is all bunched up, when we get to the end of this, we're not able to push the suction in anymore, so you're not able to get all the way down. So when we're doing it, we just want to do it a nice, it's hard to do with one hand, but we want to pull that plastic back and then stick it back in. So then when we're ready to suction, we're going to tell our patient, all right, we're going to make you cough, and then we pull that out. So, while it's not liking me. So while we're suctioning, we can do an assessment of what color sputum is coming out. Clear, yellow, thick, thin. We're able to document that. Then we also want to do a patient check. Listen to their breath and lung sounds. Does it sound coarse, wheezy, clear? Was this suction successful or not? We also wanted to make sure we monitor our assessment up here of like our oxygen. Did it increase, decrease? Did our pulse rise, fall? Just kind of want to monitor those things, especially in a critically care patient. So then we were able to document yes. So let's say the doctor had ordered a do-a-nib treatment, sounding pretty coarse. We use inline mesh nibs, so it's already in line here. We put the medication in here after verifying the order and verifying the patient. Then we can come down here, hit the button, and it'll deliver that medication. So with our filters here, instead of taking it out of line like you're supposed to, it does have an aerosol option that we can just slide over as we're delivering it, and then we can switch it back. It just delivers the medication every time the patient or the machine gives the breath. Let's say the patient has a home medication of Symbicort. We can deliver that in line as well. So this is our MDI. We can take this tab off, the little canister. We can put that in line. So then we want to deliver the medication and a breath hold at the same time. So we kind of want to time it well. So we're going to disperse and then give a breath hold and release. We're going to wait 30 seconds, disperse a breath, and hold. So you just want to do that simultaneously. So those are suctioning, MDI, and aerosol. When we're doing, so we have our event setup all complete. We have our documentation. Patient assessment would include making sure there's no kinks in the hose. The hose is on the bedside at a level, kind of level with the patient. We want to check their ET tube. Did it get pulled out? Did it get pushed in? We just want to adjust that accordingly. Maybe move it from side to side of the mouth while we're doing oral cares, just to relieve the pressure so we're not creating any sores or redness. Listen to their lungs. Are they lungs bilaterally rising and falling? Just kind of those things. Explain what you're doing, of course, to the patient, even though they might not be conscious, but it just gives reassurance. And that is all those.